When dealing with shoulders, it is crucial that you start developing your client's awareness of the brace triangle. And the brace triangle refers to the position of the neck, the position of the shoulders, and the position of the thoracic spine. So you create that triangle, which is a base for them to do all of their movements from. But most clients are stuck here. They're not able to get that mobility and that extension. Even though the thoracic spine has really little extension, we still don't want them to be stuck here. Now, some clients have the ability to actually move the thoracic spine, they're just lazy. But this video is more for clients who feel like they don't have the mobility, and you'll know because you've assessed it. So I've got Carly over here. We're going to start on the BOSU and we're going to build it up to be able to increase that mobility. Her elbows are peripheral vision. She's going to expose her underarm so that she exposes the spine at the back. She's going to inhale, reach over the BOSU, pressing her head into the hands. And then exhale, bring it up so she's mobilizing. The BOSU is soft on the upper back. Watch where she's sitting. She's not too close. I've brought her forward, and this is all about body proportions, how long their torso is. When she goes over, I want her to be able to get her head to the BOSU. So think about your client when you do that. In this position, she's pressing her head into her hands to force that extension and then slowly controlling it back up. And then she's going to inhale, press her head back into her hands, and then slowly controlling it up. And again, pressing her head into her hands. Now you're going to add this. She's going to rotate her spine that way with her head into her hands. 1. She's going to rotate over to me. 2, opposite hip holds back. Rotating that way. This hip holds back. Rotating this way. That hip holds back. 1 more either side. This hip holds back. Rotating that way, that hip holds back, coming into the center and gently lifting it up. Right, so now we take it to the next step. So the surface becomes a little bit harder. We place this in the upper back. Nice. So now because it's a harder surface, it becomes a little bit more uncomfortable because it really presses into the thoracic spine. But this is a low range, so it's not too far. She's going to inhale, release over. You want to find the sweet spot where the thoracic spine feels stuck. When she goes over, press the head into the bed and then exhale, gently bring it up. Inhale, reaching it over. You'll see she shifted to find that tight spot. And exhale, bringing it up. And some clients' tight spots are different. Watch this. As she goes over, she doesn't overarch the lower back, because when she overarches the lower back, she doesn't actually get that thoracic spine mobilizing. It all comes from the bottom. So you want that spine to hold a little bit there and then bringing it up. Now she's going to exhale over. So she inhales, exhale, because now the ribs close and it forces that extension because we're anchoring here and anchoring there and bringing it up. She's going to do 1 more. She anchors here as she exhales with the abdominals closing the ribs, pressing the head in and then slowly bringing it up. And then you can add in that rotation. So she rotates over, hips still, and it's a small movement. It's a bit more uncomfortable because it's not as soft as the BOSU, but she's just trying to hold that position with the opposite hip holding back and gently coming up in the center. And now we take it 1 step further. Now we've got the foam roller, so now the range is going to be bigger. So from here, she's going to inhale over first. So we always do that inhale first because it's a little bit less uncomfortable. Exhale, bringing it up. And again, watching that there isn't an overarch there. All right, so she's holding there with the abdominals. Inhale, releasing it over. Exhale, gently bringing it up. We reverse it. We inhale here. Exhale, we take it over. Anchor, anchor. And then inhale, bringing it up. 1 more. Exhale, anchor, anchor. Hold it. Small rotation if they can. It's really small. 1 because it presses in. Rotating 2. And over, opposite holds 3. Last one, 4. Bring it to the center and gently bring it up. Taking it out, lying on your back. That sets up that upper back to start doing the shoulder work so that we can get into that brace triangle, because it has the ability to stay upright. And if you want to learn more about shoulders, just go to the pinned comment below. I've put the link there. Don't forget to check out this video and don't forget to hit subscribe. As simple as that.